But I would like to move on to introduce the next person speaking to you. Raj comes from India and is a professor, is building, as part of his many talents, the world's first digital university. He's also involved with the United Nations Committee on Digital Health on an international basis. He has many other talents, and without further ado, I'd like to introduce him now. Thank you very much.
Thank you. Hi, good morning. It's very difficult to speak after a legend, John, and to speak before my next legend, Bladen Rees. I'm happy to be here and see influential people in the audience. You know, few years ago, rather I think more than a decade ago, I used to say that if companies got into digital health, they won't survive. And we know that was the truth. It was tough figuring out balance sheets. But now, if you're not into digital health, you wouldn't survive. That's a big change. And that's the reality of our times. This is what my friend Nigel calls as digits, which is digits. Without digits, you can't do anything. So with this, what I'm going to talk today is, I also chair this committee, which I said is IGF of the United Nations on Digital Health. But what you're going to talk about is digital skills in India. So it's very complex to understand a country like India because of the size and scope. But more than that, what you need to understand is how India, under the current leadership, is now among the world's top, probably 3, or probably should be among the first 2. If you look at the data, you will get a sense of where we are. This is a slide I have used for a long time. So if you look at healthcare, we are technically mature. If you look at any country, we are technically mature, which effectively means if you have any issue, any challenge, we have 10 solutions. The lack is organizational maturity. We are not able to fully absorb and capitalize on the opportunities that digital health provides to healthcare. So there is a big gap, and the gap is human capability and human interoperability. There are initiatives from the government, and I am lucky to have been a part of the government during those 3 years, which were historical, 2016 to 18, in terms of launch of the world's largest health insurance scheme, the launch of the National Digital Health Mission, or the conceptualization of that, which actually makes it the world's biggest, if you will see the numbers where India is. So on our initiatives, if you look at how long it has taken us during the early part of the 21st century, I would say around 2002, 3, or probably around that time, we started the Pan-African Network. It was all supported by ISRO, which is our national space agency, which is among the world's best, I guess, now, with the number of satellite launches. We started connecting the nations across Africa for training and e-health, as we used to call it that time. Then we had now the blood banks, which are digitally connected. We also have the digital health mission. And when I talk to you about the numbers, it's mind-boggling. So what has happened in India is that we have learned what others have done. The difference between India and the world would have been, we set up systems, we set up standards, and we started programs. That's a big change, because when you do in absence of that, you can actually screw up. So this is also interesting to see. Arogya Setu app, like most of the people across the world today would need what you call the paper records to carry. When I come to US or when I travel anywhere, all I have to do is open this app, which 215 million people use. But I understand this is a grossly underestimated number, because in my family, there is a central person who uses. We all 5 or 6 are registered on the app, but actual number could be 2 to 5 times. All our vaccination certificates are on the app anywhere I go, updated with my passport number, that's it. COVID app, look at the number of vaccinations, 1884 million, it's counting every day. It's done through the app. You can just register, it's in the area you want to put a PIN code, they will tell you which places it is, you can register, go at the time, get your vaccination. So how country delivers digital health? The proof lies in the delivery. I mean, if I go by these numbers, I can tell you safely, probably among the top in the world in terms of actually using digital health. There is an app that I talk here about My Hospital, so it's actually taking feedback from patients on how they use, what they like about the hospital services they visited. But I guess there is more coming on the way. This is the telemedicine platform rolled out by the government. The last number I have was 30 million consultations. Of course, average time, as always happens, here is different, but you see the numbers are before you. The proof, as I said, lies in data. Look at the hospital admissions. Since the launch of this, everything is online. So when I was looking at this presentation, as of 21st April, we were actually having roughly around 4.75 patients hospitalizations per minute, all tracked online. This is actually the real use of digital health. So what you call a health ID, the country has moved to a universal healthcare ID. Look at the numbers. This is roughly doing 40,000 records every 24 hours. We have 176.9 million IDs allocated as of 22nd April. The goal is, the Prime Minister set a goal. Let's test it out in 7 small states, which was done. Let's roll it out pan-India. So eventually, all the 1.4 billion people would end up having a longitudinal health record, something we theoretically always discussed, but practically we went ahead and implemented it. The other thing that is important is primary care. If we set the primary care system right, the subsequent levels deliver better. And the best way to integrate it, start with primary care. So one of the decisions the government took in the national health policy in 2017, and I had a role there, is to convert all the primary care centers into health and wellness centers, with telemedicine becoming an integral part of this entire. So every health and wellness center has telemedicine offering. And look at the number, it's 118,112 as of last update that I have. So all these centers offer telemedicine, teleconsultation facility. Now this is a few slides that I have in terms of how COVID has fast-tracked in the private sector. So I have this report from my dear friend who runs an online scheduling company. So look at this data. 70% people consulted for COVID-19, 1,500% surge in the peak during the second wave, 57% first-time users, 47% users between 21 and 30, 50% growth in what we call here in the US as complementary and alternative medicine, we call it alternative medicine. And the best part is average consultation time, 30 minutes. And what we see is consistent is that 1 out of 4 people have consulted during all 3 waves. That means there is an acceptance, there is a value, and there's going to be a continuity in digital consultations. And of course, specialty, I'm going to talk about it in the separate slide. So top specialties during the waves were gynecologists, general physicians, pediatrics, diabetology, ophthalmology, orthopedics. This is what you see all 3 waves. So wave 1 in pediatrics, the growth was 11 to 175%. That's massive. And the numbers that we talk in India is not in tens of thousands, it's actually in millions. That's the big difference. So a small percentage in India is a big number. The growth in general physician is 28% to 261%. Of course, it's tapered down post the second one, which was 604%. We hope the momentum will catch up. In gynecology, if you see, it's again gone up, it's brought down. Ophthalmology, if you look at growth post all 3 waves, is more than 650%. If you look at orthopedics, it's more than 400%. If you look at neurology, it's more than 400. If you look at diabetology, it's 450%. Because when the time you actually want to avoid having hospital infections. And there's an old theory that if you do anything for 3 weeks, it becomes a habit. When you do anything for 3 waves, I don't know what happens. I don't think people who have used digital consultations are going to go back soon. Alternative medicine, I mean, it's still amazing that the numbers keep growing up from 28 to 128, which is homeopathy, and Ayurveda is 10 to 132, which is phenomenal, actually exponential growth. The growth will be a wrong word to put here. And I'm going to talk about 3 surveys which I did in the company that I run, which has got Health Parliament and the Academy. So we tried to understand that why just we focus on clinicians, let's also focus on the actual gatekeepers of the healthcare system. So we did a study with nurses, probably among the largest. So 4 out of 10 don't get training on digital health. That's the digital skills that we need to look at. We did another one with pharmacists. So 3 out of 10 don't have a training on digital health. So huge gap. As we speak, we are doing a study with ASHA and Anganwadi workers, which roughly number around 1 million plus in India. And when we asked them that, are the digital trainings helpful? 65% said yes. But there's a huge gap on the trainings that they get on digital health. At this time, it's not. We need to also understand the scale in India in terms of what digital health trainings need to do. So this is the beds across private and public sector, and total we have is 1.89 million hospital beds. This is the number of healthcare professionals. If you really look at the universe of clinicians that we need to probably train, the modern medicine doctors are 1.3 million. Ayush, which is Ayurveda, homeopathy, yoga, and Siddha Unani, is 500,000. Nurses 3.34 million, pharmacists 0.8 million, dentists 0.28 million, and more importantly, 150,000 medical graduates every year. Their course is so compact, so squeezed in for the 5.5 or the 2.5, 3 years they do in post-graduation. There is no scope to add digital health. So we realized this was a big gap, and that the world's healthcare, even everywhere in the world, we are moving to a digital health. We need to train them for digital health. So, and the kind of skills we need. The first skill we need is using digital devices. I'll give you my example. I would not shy to say that. I'm a gadget geek. Any gadget that comes in the market, I would buy it. I'm not a technology geek. I don't know how to use it. I got to ask my colleagues, please tell me how it works. So we need to first look at the digital devices that's available. How do you use it? Let's not assume that everyone can do it. If I on stage at ATA confess I can't, what about the frontline health workers? Communication. There is a big campaign globally we'll announce in the second half of this year from Health Parliament. Communication is the biggest disaster in healthcare in terms of not communicating the right thing and rightly. Data analysis, people don't know, they sit on tons of data. We're talking of big data when data actually is not used. I say we keep dreaming about big data and AI when we don't know where's the basic EHR. Data handling and storage, what scares most people when I talk to is that, hey, I will collect data, but what happens, God forbid, if the data is stolen, if it's lost? How do I keep it? Where do I keep it? Most of the people have to even explain what a server is. You can have a cloud space, cloud server. Knowledge of digital health technologies. I would not challenge, but if I asked you what is the difference between digitization and digitalization, I promise you, not everyone will be able to explain. If I went ahead and said, and I did the same mistake a decade ago, that AI and ML will change healthcare. AI and ML are one and the same. It's the application. As the layers get more complicated, it becomes deep learning, then neural network. So basics of digital health have to be understood to use it. Then you have the clinical decision support. The clearest and the best example of using AI, the safe transactions. We're starting this course effective July. It will be available. Which is globally going to be available.